To this evening's Communities Committee. My name is Jabbar Ayaz. I'm the chair for this evening. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photography, making an audio recording, providing commentary on proceedings. Please note the meeting is recorded live and streamed live. These recordings are published on the relevant meeting page of the Council's website. By choosing to attend, you are deemed to have given your consent to be filmed, recorded, and for any footage to be broadcast or published. If the alarm sounds, the premises must be evacuated immediately. Do not spend time collecting your personal belongings. All emergency escape routes are clearly signed. Once you have left the building, the assembly point is in the High Street opposite the Guildhall. Members and other speakers are reminded to use their microphone when speaking. Thank you. Okay. Julian, do we have any appointments of substitutes?
No substitutes.
Thank you. Can I have declarations of interest, please? Councillor Murray.
Thank you, Chair. Just a non-pecuniary interest, but I'm a trustee of the Lippard Hub, and I'd like to just say a few words on that on item 8. Thank you.
Okay, thank you. Councillor Lawrenson.
Thank you, Chair. Is that working? Yeah. My employer is Sanctuary Housing.
Okay, thank you. Any others? I'll declare an interest in as Chair of Worcester Mellor, which is I think is mentioned in the Community Engagement Strategy. Councillor Sarah.
I did it in the other meeting, so I think I may need to declare an interest in that my husband and I privately give a donation to Worcester Festival,
Okay.
which is part of the next some other item.
Sure, it's not pecuniary, is it? So.
Well, I give money, but...
Okay, fine. Councillor Lamb?
Just to say I'm a trustee of Worcester Festival, and that's obviously referred to in the documents later on.
Fantastic, thank you. Any others? Good. Julian, are those recorded?
Yeah.
Thank you. And item number 3, public participation. Bertie, we have public speaker Bertie Ballinger. Please come to the desk, please, Bertie.
Thank you, Chair. Last July, 7 months ago now, I spoke in this chamber at the Policy and Resource Committee when this council decided to remove the Community Engagement Officer role through a mixture of early retirement, redundancy and staff redeployment. At the time, I said that the decision was short-sighted and pointed out that volunteers saved this city just under £1 million a year through volunteer hours, and that this success in no small part was due to the Community Engagement Officers making volunteering accessible and easy here in Worcester. Despite those warnings, the council went ahead with its plans and Worcester suffered as a result. I was therefore surprised to see job postings for community engagement officers, but then I read this committee's agenda and the Worcester City Community Engagement Strategy Development Report. Although on reflection, perhaps I shouldn't have been surprised at all, because to have a community engagement strategy, you do need community engagement officers. I've read the report carefully and just wanted to raise a few concerns. Firstly, the reduction in staff in the report is described as a temporary reduction in capacity. Temporary for whom? It is certainly permanent for the staff who were forced into early retirement or made redundant. It is permanent for those who moved into other roles. It appears temporary only for the council, which seems to remove and reinstate staff when it suits. Secondly, the report states that these new positions will be funded by grants. Can the council confirm how long these grants will last? Will they last long enough for community engagement officers to genuinely get to know the communities they serve? Or when we reach the next budget round, will this role once again face so-called temporary reductions in capacity? Finally, the central theme of Worcester City Plan 25 to 30 is strong and connected communities. Yet myself and other members of the community felt abandoned by this council decision to remove this role last year. But I'm glad the council has made a U-turn on this. Thank you.
Thank you, Bertie. You'll get a written response as a result of that. Appreciate your time. Thank you. We don't have any other public speakers, do we, Julian? No. Fantastic. We'll move on to agenda item 4 then, which are minutes of the previous meeting. Go through them page by page. Page 1. Page 2. Page 3. Page 4, Okay. Are we happy to agree them as true and accurate record? Fantastic. Councillor Sarah?
I might be wrong, but page 4, should that last thing say the next meeting rather than chair at meeting? Just a tiny little.
That's for me to sign if they're
Oh, that's
if
for
they're
you
a
to
true
sign,
for,
okay.
for
On
they're
this
a true and
particular
accurate
day.
reading. Yeah.
I do apologise.
That's okay. No problem. Thank you. Anything else on that? Thank you. Those are carried. Okay, agenda item 5, we have Worcestershire County Council public health update for Worcester City. Can I welcome Matt Fung to the table, please? Matt, welcome as always. Thank you. This role was previously, Matt used to report at the Health and Wellbeing Committee before the committee's business got merged into the Communities Committee. We will welcome Matt to the table. Councillor Wilmore. We good? Good. Matt, all yours.
Hello, thank you. Thank you very much for having me. So good to be back. I think we came back about once a year, didn't we, about this time? So good for this annual update. I've got some slides that hopefully will come up on the screen and that may well have been circulated to you before this meeting as well. So when those come up, I can start the presentation. Fantastic. I always struggle with this screen. It's always quite difficult to know how big the text should be for everybody to be able to see it. So hopefully you'll be able to, it'll be legible to all of you in the room. But we'll talk through anyway, and hopefully the clicker will work too. There we go. Okay, so I'm going to be talking through very briefly, because this is a big document that this presentation is based on. We present each year to the Health and Wellbeing Board at County. And this is essentially a very small extract from a much larger document and set of resources that will hopefully bring you up to speed with some of the indicators that are relevant to Worcester City. By no means is this like everything. It would take us all year to get through all of the indicators that pertain to Worcester City, but this is just some of the content that is relevant to you. So it's going back. So we'll be talking through a bit of data and resources that I want to update you on, because that, there are some very key sources and sites that will really help with your understanding about your own communities. So I want you to kind of have a look at that. Some of the data-driven action as a result of some of the indicators that we'll be talking through. And finally, the community-based support that is happening as a result of, again, this intelligence. So to start with, just onto the data, insights, and resources. So some of you may have already seen this website. It's our Worcestershire Insights website. On this website, there's a huge amount of information there. Stories, community stories, updates on our grant programme that I'll talk about a bit later, and a huge amount of data that you were able to access freely, right down to very small population level. So right down to, we call it lower super output area level. So, around about 1 to 1,000 people within a defined area, you'll be able to find out about those people and the health status of those people. So you can use this site to create custom reports, custom maps, and really use that to, as I say, understand your communities. What we're finding is that people are using this type of data to kind of apply for bids or grant funding, or to kind of attract funding into those areas, addressing specific needs within those populations. So that's kind of how we're seeing this type of intelligence being used. It's generally based on the latest census data, but as population projections, etc., get updated, then that feeds through onto the site as well. Just going forward, This is just a bit of a snapshot of the site, and it's very easy to access. You can literally Google Worcestershire Insights, or you can go to the URL at the bottom, and that will take you straight to that website. Okay. So have a look if you're interested and you want to kind of use that resource. If you can't find what you're looking for, if you're struggling to get to the exact population within the website that you're interested in, there's a request form on the website so that you can put in a request to Public Health and we can help you out. So again, we're having requests come in specifically for people who want to know about population and they've got a specific purpose, like a grant that they want to apply for, and they want to get that specific bit of information. If you let us know, we can help you out. But I suggest you go and have a look first because it is quite easy to navigate around. So the kind of ward profile requests that you can put in, parish and town council requests and electoral division requests, and we'll do what we can to, again, provide you with the information that's going to help you with what you need to do. On the website as well, there's lots on population and population growth and change. And specifically on this slide, you'll see at the bottom, Worcester City kind of bumbles along the bottom. There's hardly any growth, theoretically, between 2022 and 2032. And that's quite an interesting picture because you can see places like Wychavon are kind of shooting at, it's blocked by the picture on the screen there, but that's Wychavon kind of as that top line. And the difference is really stark. And I think we just need to be aware of things like LGR that I think will obviously change this in the future, and also where houses are being built around the county. So even though Wychavon is going up significantly over a 10-year period, actually a lot of that impact won't necessarily be in Wychavon. It will arguably be for Worcester City. So it's this type of thing where actually district boundaries and county boundaries, city boundaries aren't particularly helpful because this is misleading, I think. Yeah, and this is what's presented at a national level. That it swings and roundabouts. As soon as we go to a county, whether it's one or two area, whatever it is, we will lose this granularity. So we like the granularity, but we don't like it when it's misleading. So just to bear that in mind. Also, we have some quite detailed reports around migration. This is a new aspect of kind of publications by the ONS as well. So we have a lot of data on there around migration. Again, you have to really look at these stats with a really keen eye because you can, again, it can be quite misleading sometimes around what's going on. Let me pick out internal in-migration and internal out-migration. This is over a 10-year period to 2032 again. So internal in-migration, 68,000, internal out-migration, 70,000. That sounds a huge number of people, and it's like 70% of the population of Worcester City, but that clearly isn't happening. What that is referring to mostly is churn within the student population, okay? Because we know that is responsible for the majority of that in and outward migration. So the data's there, it's interesting to look at, but take it with a pinch of salt because it doesn't tell the whole picture without really understanding the underlying reasons for why the migration is happening as it is. So anyway, my central point here is, just going back to my original point, is the population growth, arguably in some of our surrounding districts, is more relevant than even some of this data here. That would be my central point there. Okay, I know that I've been asked to kind of look at some of the, these are some of the public health outcomes framework indicators, so very high-level indicators for Worcester City. Again, there are thousands of these things, so this is like literally a snapshot of some of the key measures that public health are benchmarked on and where performance managed on. And this is just specifically for Worcester City, and sorry, the text isn't particularly large. I'm going to just talk about the red indicators. All of the others are either similar to England or better than. So where it's red, it's significantly worse than England. Where it's amber, it's similar to England. Where it's green, it's significantly better than England in Worcester City. So the first one there is male life expectancy. That has dipped over the last couple of years. I would say that this is one of those indicators that can fluctuate, and it is quite sensitive based on the number of deaths in a given year. And I'm pretty certain that this is linked with, it's all-cause mortality, but specifically cardiovascular and respiratory mortality, and particularly in some of our more deprived communities. So that's going to be an indicator that's really going to shift that red dot there. So that's some of the reason behind that particular metric moving. And I'm going to talk about that in a bit more detail because we've linked this directly to driving partners, including the NHS and GPs and primary care networks, to do something different to address this specific issue. So we can do something about it. So these are red indicators at the moment. It may take some time to shift them, but we're working on that actively. The next one is hip fractures in people over the age of 65. I'm going to talk about another intervention later, which is really relevant there, so hold that one in your mind. Estimated dementia diagnosis rates. You know, it's one of these metrics. If you don't look for a problem, you're not going to find it. So if we're not screening enough, that you're not going to find enough people. And that's basically what that indicator is saying. Perhaps we're not screening enough people. But it is a synthetic metric, so I'm not sure whether this one actually stands or not. It's synthetic because we're benchmarked against where NHS England think we should be, not where we actually should be. Does that make sense? So there are differences in how all of these indicators are put together. The next indicator is probably one of concern, which is alcohol-related admissions. That is trending upwards in Worcester City significantly. And this is a group of people that won't necessarily be at the threshold that they would benefit from our substance misuse services, which deal with significant alcohol problems and significant substance misuse problems. So that I think it's probably a gap in kind of picking at people who may be casual drinkers, perhaps people drinking every night, but they don't reach a threshold of needing, intensive support. But there's lots of people out there that will be drinking lots, but not to, as I say, not to a level that requires support until they need support. And that support is because perhaps their liver isn't working quite as it should be. Perhaps they've drank so much and they've had a serious accident or got into an altercation or whatever it is. So that is a concern, and we do need to look at that and do what we can collectively, because this isn't just a public health issue, this is a system issue around how do we start to reduce that figure. Infant mortality rate is also a concern for Worcester City and wider Worcestershire. This is a metric that has been a concern for the last couple of years, really. It's picked up by a specific group called the Child Death Overview Panel, who publish a public report, so every child death is reviewed and learning is published. So that is an indicator that is actively looked at. I would say, and this isn't to diminish this indicator at all, even 1, 2 or 3 deaths in children could shift that indicator from being green to red, because there are fortunately still quite few numbers or few deaths, but it only takes a couple more in a particular year to shift it, as I say, from amber or green to red. So it's one that we're actively looking at. Right, the next page, this is the last page of data, I promise. We've got some children in relative low-income families. That's significantly worse in Worcester City than England, but you might expect that on one level, given the geography and the population, as well as homelessness. That is another indicator, again, as you might expect in Worcester City compared with England. So you compare them against all of the county authorities, and so you're not comparing like with like. So you might be comparing very rural areas, or you are comparing very rural areas with places that are more built up like Worcester City. So again, it's an indicator that we're aware of, you know of as the city, dealing with homelessness and addressing homelessness problems, but it is an indicator that's flagging red. I don't know whether you want to ask questions at this point, or whether you want me to just to go through and then we have questions at the end. What would you like to do? Sure, no problem. Okay, this is the last, as I said, that was the last slide there. This is actually the last data slide that I want to talk about. This is childhood weight. And although Worcester City is similar to England, so we wouldn't flag red, this is the problem with indicator tables, because being amber or similar to England doesn't always mean that it's the place that you still want to be. Because England might be really bad. England is really bad for childhood weight. So it shouldn't diminish our aspiration to do something different. And this is just to show you, you can't really see too well on the screen there. There are relationships, very strong relationships between deprivation and children who are overweight or obese. The kind of bars on the left-hand side are for reception, on the right-hand side are for childhood weight measured in year 6. And you can see the gradient. So the pink is the most deprived, the black or dark blue there is the most affluent cohorts. So you can see a clear kind of link there. And at the bottom in the blue box are the Worcester City figures for overweight and obese children. So 22% are overweight or obese in reception, rising to 37% in year 6. So to me, that is a fairly stark metric. It's actually one of our best data sets, because we literally commissioned from Public Health this programme. We have to commission it as a national programme to measure specifically every child in reception in year 6. So it's a very good data set, but it shows the transition from reception to year 6 and the overweight and obesity problem that accompanies that. And it does set some of the life chances of children right from primary school. You know, if not in terms of employment, certainly in terms of health and well-being. So it's a metric that we were cognizant of, and again, we can talk about that later. Okay. So this is just, again, to talk about some methodology. I don't want to bore you all to death. This is just to recap some of the methodology that we've used around identifying those very specific areas across Worcestershire, including Worcester City, that have a higher than expected rate of emergency admissions to hospital, to narrow down, to identify those specific areas and to create action plans around them and to do something about it. So often we have so much data that kind of sits on dashboards and databases that looks lovely, but nothing is really done as a result. And we wanted to get away from that and make it very actionable data. And the SPAY patterns are basically, well, yes, we have to provide health services, for instance, to the whole population. But where we have discretion to do something a little bit different, to focus in on specific areas, is going to lead to more tangible gain than it is to fritter that small amount of resource across wide areas and wide populations. So that's the point of that particular graphic. So this is basically it. We use some statistical analyses to identify some high priority areas, these priority neighbourhood areas across Worcestershire, 2 of which happen to be in Worcester City, that's Brickfields and Old Warndon. And essentially that has led to very specific action coalescing, if you like, around those specific 14 areas. So these are based on all-cause admissions, respiratory and cardiovascular disease admissions, and have been the basis of, as I say, a lot of action. Again, we can pick that up in a bit. We then extended that work so that it made it relevant to every primary care network across the whole of Worcestershire, because we wanted to pull primary care and PCNs on the journey as well around thinking about the whole population, yes, but also focusing their attention on some of the small areas that would benefit from different types of intervention. So we expanded that analysis, we changed the criteria slightly, we came up with 60 small areas. We did a deep dive in a number of these areas, and that's some of the output at the bottom there, where it was a shock to be honest, some of the GPs, because when we looked geographically at some of these populations, when I say negligible rates of health checks, in some of these areas, there were almost no health checks, NHS health checks done ever for any of the population, which is surprising, because you would have thought that some people would have gone, but there seems to be kind of, where there's a culture of good health and well-being, it kind of fosters good health and well-being. If your neighbour and your friends are going for their health checks and their screens and their immunisations, it's much more likely that you will too. But where you've got the opposite of that and where people aren't going along, I think that's kind of entrenching a health behaviour in that community that almost was invisible when you look at the data on aggregate, because it kind of disappears into, oh, we're doing really well on health checks. Yeah, but except in these specific areas where there's almost nothing going on. So that's what this type of work has led us to identify, to uncover populations. The NHS, nationally and locally, we have different ways of expressing it. Some people call it inequalities, some people call it unmet need, some people call it barriers to access, whatever it is, hard to reach populations, whatever it is, these populations exist, they're under our noses. You guys are right in those communities too. So it's what it is as well is a lot of preventable illness and behaviours that whatever messages we're putting out historically haven't landed. So kind of on social media saying stop smoking, or national campaigns, dry January or whatever, don't drink, it's not landing. Go for your health check, doesn't get through. So we need to find different ways of communicating directly with communities such as these that we've identified. And this goes right from general practices through to the ICB, who commission NHS services, through to yourselves, public health, wider county council services, VCS. Everybody has a stake in this. And as I say, the way in which we communicate with populations will literally determine the health outcomes of those populations. So it's a really important piece of work. And what is really great to see is this is a very, very high level snapshot from the Worcester City PCN plan. Oh, I haven't moved it on, have I? Which is starting to form around the two LSOAs in Worcester City. This is evolving, it will change over time, but their aspirations are to, yes, they've always done social prescribing and wellbeing support, but what they're going to be doing is very targeted social prescribing and wellbeing support in those LSOAs, because clearly there's a gap and the community hasn't been able to engage with that. Warmth on prescription, because we know that these are some of our more deprived LSOAs. These are populations that will benefit from that support more than more affluent areas. Health check events, improving understanding around lifestyle health literacy and long-term conditions. National screening programme promotion, like cervical screening, that's one that they have to pick up anyway, but needs to be more targeted. Breast screening, AAA screening, etc., etc. There's an awful lot in there that needs to be done. And as I say, this will be added to. This is like the start of a new approach for the PCN in Worcester City and across the whole of Worcestershire. So we've led the way with the data. We can't obviously do all the interventions. The practices know specifically who hasn't been for X, Y, and Z, and they can target accordingly within these areas that we've said are an issue. So that's basically that piece of work. The final bit I promise on this is to iterate it further, because what I've talked about over the last couple of slides is for predominantly adults, and we wanted to do something for children as well. So what we did was use, again, some statistical approaches to identify small areas that related specifically to children. Okay, and this is essentially what we came up with. So these are 13 MSOAs, so slightly bigger areas, but what that led to is the development of family hubs. So we used that data to locate family hubs around the whole of Worcestershire, and you can literally Google family hubs Worcestershire and you can find this map and all of this type of information. So these sites have been situated around those higher priority MSOAs, which I say are slightly bigger areas, and family hubs are great. They're a fantastic asset. They do all kinds of different work, right from preconception through to young and growing families, through to young people as well, and we'll pick up a huge amount of the issues that we know impact school readiness, childhood overweight and obesity, ascertainment through various ages to kind of growing up. Obviously, health checks and health visitors, etc., etc. Huge amount that we can do there and that we can leverage kind of obviously through public health and family hubs, but also wider as well. I mean, we're just using these at the moment to run pop-up clinics around MMR and HPV clinics, so vaccination hubs that we're running. And so it gives us a capability to do something right in the communities that we know we need to kind of do more with in a dynamic way. And yeah, that's an asset that we absolutely collectively need to leverage. Right. This is just a bit, I don't want to take up too much time now on some of the community-based work, and this is just from a public health lens. There's a huge amount more going on that I'd be remiss not to mention, but these are just a few public health programmes, really. So Healthy Worcestershire, you all know about, I think, and we couldn't really do this without member engagement and involvement. But I would say it's a growing programme. I think it's growing in number and strength and in the range of topics and interventions that it's picking up. Shockingly, it's back out, well, it will be back out to tender very shortly because the 3 years will be up. So we will be re-tendering for this programme and growing it as well, adding to what it does. And in Worcester City, there you go. Those are the Healthy Worcestershire's currently running in Worcester City. Again, you can Google Healthy Worcestershire and get onto this yourselves to find out about the programme and when it's running and what's going on. But again, a great platform. I probably mentioned this maybe last year, but it was recognised by Chris Whitty, the CMO for England. So it does have that national kind of standing as well. Work Well Live Better is our healthy workplace scheme, if you like. This is actually drawing to an end in a sense. It's going to be wrapped up into Healthy Worcestershire, but it's a great way of improving the health and well-being of our workforce, which is a really important topic and intervention that we have in place. So we'd encourage anyone and everyone with a business or that works in HR or whatever in kind of organisations to sign up to Work Well Live Better and its successor. The last thing that I want to mention, and possibly all of you have heard about these, are the community grants that we have in public health. This is a fantastic programme which is tied to, again, all the data that you've just been shown. It's a way in which we can give small grants to grassroots and community organisations just to get things running. Like practically, sometimes a group just needs a couple of £1,000s to buy the equipment that they need to get like whatever passion it is for their community going and off the ground. And that's basically what this is doing. Yes, there are some of the grants that we give to schools to do different bits and pieces, particularly around buying play equipment or doing some really novel things that they literally don't have the budget to do. And through our community wellbeing grants and these small grant programs, the impact is fantastic. And that's the gist of a lot of what the Worcestershire Insights website is about. It's kind of showcasing a lot of that work and just putting on a platform really what is possible with just a small amount of money. So that's kind of the programme there. Final slide is this one. Sorry, the text is a bit small, but these are just some of the categories around the community grant work. And I think the back has been kind of sent around, so you'll be able to have a look at this if you're interested in some of those kind of example kind of grants and some of the thematic areas. The sky is the limit, really. It really just depends on the creativity of the community, having key people saying, you know, I have a passion for my community, I want to do something different, I want to improve health and well-being, whatever that is. If you have people in your communities that are doing that and want, you know, to engage with this, if they have a specific need around, you know, buying some equipment to get it up and running, then let's have a conversation. And that is it. So thanks very much. Really happy for any questions.
Thank you, Mark. Thanks for that. There's a lot of data obviously there to absorb and sort of delve into. I'll open it up to the floor now. I'll have Councillor Amos, Councillor De Serra, Councillor Kinnersley, Councillor Woolmore and Councillor Lawrenson.
Thank you, Jen, and can I thank you for an excellent presentation, marred only by the fact that I couldn't see most of the slides because the words were too small, but I listened. So, Chair, would it be possible to have some of those slides circulated at a later date? Thank you. I've just got 3 points because I think, really, there's nothing I disagree with what you said. I think you're spot on in many cases. Hotter on the analysis, I think, than solutions, but I mean, none of us have got solutions to many of these problems. Can I just highlight 3 things that I think that are important, that I find in a role I've got at County Council? Lifestyle is quite a major determinant on health. Certainly, whether you're in work or not. I saw some statistics the other day about NEETs, people not in education, training or employment, amongst the young people, and that's gone up. That is going up, and that's very worrying, because that does affect their lifestyle, and their lifestyle affects their health. Yeah. So there's that issue. It's a huge issue, because that is something that seems to be getting worse. So this direct link between work and lifestyle and health. Secondly, very interesting, but you didn't, it's not a criticism, you didn't mention once the word parents. And I think we're missing a big source of help here, because parents, when we're talking of young people, it seems to me we've got to be looking at the role of parents. Because you're absolutely right, when I represented Warndon and so on, there's a cycle of deprivation. You look at young people, teenagers, adults, they have children, you can see it. It's so frustrating. We can't break this wretched cycle of deprivation. For example, immunisations. I mean, many parents, an increasing number, I hope it doesn't increase any further, against immunising young children. That's obviously a very direct link with health. You know, I'd welcome your comments on that, and anti-vaccinations and all this kind of nonsense. And also the obesity. I mean, I'm really hardly one to talk myself, but at least I'm a bit older than a child. Diet. You know, what do children eat? That must be down to the parents. It isn't down to the state or television adverts or anything. So, and the final point is community grants. Can I just thank you, because I know of a particular group I'm just dealing with at the moment, an over 60s group, and they got a grant, a community grant, for a group that they run, primarily to stop social deprivation. They're elderly people, they meet together to do something constructive with the help of the local community. And that grant has been, it's more than it's worth its weight in gold, frankly. So if you can keep those up, I'll be very grateful. Thank you, Chair.
Thank you. Thank you for the questions, all very pertinent, and I don't disagree with any of them really. The lifestyle issue, let's start there. You know, one of the most potent determinants of health is what? It's income, it's money, which essentially comes through work, ideally. So I don't disagree at all. I also don't envy the position of our young people growing up these days in an increasingly uncertain world, where who knows what the jobs will be that they're going to be doing in the future, not even thinking about the people who are currently not in work. So I think that it's going to be an issue that we need to collectively work on, continue to work on. NEETs, you know, that requires, it's complex. If it was simple, it would have been solved.
Oh, I agree.
You know, so we need to not put it to the wayside because it's too difficult pile, but continue to work on it and find solutions. You know, I'm a big believer in things like vocational type opportunities and, you know, kind of practical experience.
Absolutely right.
So
Apprenticeships.
Exactly.
Apprenticeships, exactly right. Exactly what we're doing up at County, yeah.
So the more that we can do of that, County, obviously we have our own approaches and strategies, and obviously we offer our own kind of apprenticeships and vocational placements. The more that we can get the wider economy and businesses to join with that, the better. I'm sure there's a lot going on already, but I think we need more of it. Absolutely. So parent cycle of deprivation, I don't disagree with that either. You can see it in the data. You can see it in, unfortunately, as your county councillor as well, some of the, you know, some of our issues at county is essentially looked after children. Children coming into the system that can't be cared for whatever reason by their family, and it's really, really sad.
It is. It's bust the budget up there, frankly. It's bust the budget.
Exactly. It's really sad and arguably preventable on so many levels.
I agree.
We have to get into some complex conversations, though, don't we? It's a wicked issue. If it could be solved easily, it would have been done a long time ago. This relies on parenting courses. It relies on, you know, if someone grows up in a broken family, the likelihood of them fostering a broken family themselves is very high. Fostering is probably the wrong word there. You know what I mean? Kind of having their own family themselves is high. We need to think about things that you probably haven't thought about before, things like sexual health. We commission sexual health from public health. is things like contraception accessible particularly in some of our more deprived communities. You know, if people don't know about services, how are they going to access them? So we need to think about things that, and join up data. It's not all about data, but the data drives or should drive the action. And so if we know about an area that has a particular issue, then I'm sure that we've got some solution around the system that we can kind of tweak in a certain way. So that's immunisations, anti-vax. You know, you're always going to have different groups, anti-vaxxers, etc. I think that raised its head quite significantly through COVID and beyond. There are some glimmers of hope, though. You know, things like MMR, I've been concerned about. We're really good in Worcestershire for measles, mumps, and rubella vaccination, but we have seen a decrease as well, particularly since COVID. We were around about over 90%.
Yeah, it's gone down.
It has gone down.
Yeah.
But we have got a new vaccination now, which some of you may know about, MMRV, which the V stands for varicella zoster, which is chickenpox. So that gets added to MMR. And I suspect that our rates will start to go up, not because people want the MMR bit of the vaccine, but they want the chickenpox part of the vaccine. So it's literally just been launched this month. So we'll see how that actually goes. But I'm expecting there to be a bit of an uptick in our MMRV uptake. You've mentioned diet. Diet is complex. It's more complex than any of us would even understand. I bet you if each one of us analysed what we each eat, I'm not sure that we could put our finger on why we do that. But probably, you know, some of it will come from family and what your mum did, what your parents cooked for you. But unfortunately, diet is so much driven by cost, and the things that cost the least are quite often the things that are most unhealthy for you.
Okay, thanks, Matt. Do you
Sorry?
want to sum up that point? I've got a number of other
sorry.
speakers.
So we'll leave that one then. Community grants, yeah, thank you. I agree.
Yeah, thanks. I mean, thank you, and that's a comprehensive reply, Matt. It's not as simple as blame the parents. There are a lot more complex situations in that. We have to ask ourselves the lack of data that has been in there and the lack of approaches that we have taken to try to get that data. Why is these communities being left out? Why have they been marginalised, and why have they not getting the same level of support? So that's the detail that we need to understand, rather than just simply blaming parents for the lack of and passing that on, although those are familiar traits in terms of that, but it's years and years of neglect that have gotten to that place, and you understand, and they are subject to external factors like heavy marketing, like the big companies marketing their poor choices of food choices in their faces and the easy options that they've got. So it's a lot more complex than we make it out to be. Councillor Tissera.
Thank you, Chair. Yes, thank you for the presentation. And my ward is covered in and highlighted. I represent Walden and Elbury Park. So a couple of things to say. I was dealing with a group from Healthy Worcestershire last summer. They actually before that, they were coming to do sessions at the St Wolstons, which you mentioned. And we're struggling to get people to come along. So we had a chat with them, Ed and I. And we just encourage them to relaunch themselves as something that might be appealing. So, you know, don't put a poster out that said anything to do with health. Call it fun, you know, and you might get people to come. And I think that had some effect. But what was very successful, this might have been separate, a mobile bus turned up to do breast screening and things like that, and actually went into that area. And that was, you know, I think particularly well received. But when we come to like health, diet, etc., I'm finding because I've run the Open Door Cafe for more than 3 years there now, and for a lot of people who come, they come because of social isolation, but they also sometimes come for the food itself. But they rarely have home cooked food, and I think since domestic science, as it used to be called, was removed from the school curriculum many decades ago, people don't know how to cook. And I don't agree that the cheapest option is the most convenient. The most convenient is to buy processed food, which is the least good for you and actually quite expensive. So part of what we're doing there is to try and teach people about home cooking, how easy it is. We're doing slow cooker giveaways in the short term. It's tiny, number of people being affected. But if that aspect could be addressed, perhaps in the schools, about teaching people to cook for themselves, I think that might eventually have a good outcome. And the other thing I just wanted to say was, what about, well, as far as community engagement goes, I think what would happen a lot is if we could liaise with the social landlords around there so that they would reinstate the local housing offices where people could walk in and talk to a housing officer, because that could then be linked to all sorts of other help and support that they wouldn't otherwise go out and find. And that's just a suggestion. People talk to me all the time about how much they miss the fact that they have to log online or wait on the phone for 45 minutes to report issues and problems to their landlord. So much easier when they used to be able to just walk around the corner literally and go and speak to somebody. There's so many other things we could hang off that if we could get the RSLs to reinstate them. That's anyway. And finally, some more sport would be good, really. That would also help, because again, it's been withdrawn. It's not on the national curriculum when it gets to a certain age. And I think it would be helpful if children could be encouraged to be more active as well than they are. Thank you.
Thanks, Councillor Sarah. I didn't spot a question in there, so I'm going to move on. Is that right? I didn't quite...
The question is about working with the RSLs to try to encourage them to reinstate the local housing offices. That would be the ask.
Sure. I don't know if that's Matt's role. Or
if he's working at a national level, and they can go up here and make an encouragement.
quick response to that, Matt?
There's loads in there. I don't disagree with any of them, apart from we can have a debate all day about food. There's a concept of food deserts, which will prevent people from accessing cheap, nutritious food if they live particularly in deprived areas. Anyway, that's for another day. We're just in conversation. This is not set in stone yet, but we're in conversation with Active Heritage in Worcestershire at the moment. This picks at some of the sport and physical activity, because what we need to be doing is thinking smartly as a system around not just building homes, but building homes that are going to facilitate physical activity where people aren't scared to get on the street because they're on main roads and there's no active travel or kind of places for them to play. So we're in conversation with Active around how can we better influence the planning system. How can we get kind of physically active places, for instance, centre to the development of all of these new housing estates that are kind of cropping up all across Worcestershire. That's only one aspect. Yes, the more sport, the better. We need to get people off their bums and, moving as much as possible. So, absolutely agree.
Thanks, Steele. I mean, your points are absolutely valid. I was just trying to tie it in terms of that. I think I've got Councillor Kinnersley next.
Thank you, Chair. Echoing everyone else, thank you very much. Really interesting presentation. And I applaud your enthusiasm. It must be quite a difficult area to work in. You must feel like you're stemming a tide of kind of moving in the wrong direction. So, it's great to hear the enthusiasm. I've got 3 specific questions I just wanted to ask. Actually, going back to the data, quite interested in the data side of it. My ward is St Clement, so we have the university. So a lot of I looked at our stuff before the meeting, and I could see that there were some quite surprising outcomes. And I thought, okay, yeah, that's the university's influence. Is it possible to do some manipulations to remove that skew so that I could look at, so for example, St Clement data and understand it without the skewing effect of the university population? So that's question 1. My second question was about comparators. It's what you described in the presentation, the comparators were England. Is it possible to, are there other comparators? I'm thinking, for example, with the police data, they have most similar groups, most similar areas. So you could sort of pick out a comparator that's more relevant to Worcester City. So that's my second question. And then my third, if I may, I'm interested in how you pick up on new trends and how they are identified and then picked up into the data. And I'm thinking particularly of ketamine abuse amongst young people. I've heard recently that is a massive concern on the up, and that didn't see that in the data. But how do you recognise and then incorporate new trends that are coming into the data? Thank you.
Thanks, all really good questions. I'll be as quick as possible. So skew of university data, it's difficult because a lot of the data that's presented on the website, is that what you're talking about? It's fed by essentially census data. and updated projections. So until that's redone, you won't disaggregate previous university students having filled in a census return. But we do have other data sources that we use. So we can get data feeds from, depending on the need, of course, primary care or secondary care. So it depends on what we're looking at, really. Comparators to Worcester City, absolutely there are comparators to Worcester City. We use CIPFA comparators most often. And yeah, so we can get a different set of data that will give a different set of indicators for Worcester City. New trends, absolutely, we pick up new trends all the time. Ketamine and things would absolutely be picked up by our substance misuse services, so Cranston. But also, we put out drug alerts to the NHS as well and to the emergency department. So if there's a particular drug doing the rounds, we'll put out an alert to the clinicians on duty to say, look out for these symptoms, and it could be related to this particular drug. So what I'm saying is there's kind of strategic intelligence and also tactical that we kind of have going all at the same time.
Fantastic. Councillor Wilmore?
Thank you. I'm delighted that Councillor Amos has taken such a keen interest in public health, and I might suggest that he has a little chat with some of his party colleagues at County who shamefully...
This is out of order. This is disgraceful.
No,
This is disgraceful.
no, you haven't heard my point.
I'm not going to have my party drawn through the mud. Well, this is completely irrelevant to this discussion.
No, it's not.
Absolutely appalling.
It's not, because it's about vaccinations.
Absolutely appalling.
It's not.
Alan, you'll have because you've been named, you'll have a right to reply.
Okay. I was going to ask, during a recent debate on vaccinations, several of your party voted against it and actually said some things that were not true and were misinformative. So it was going to be a polite request that if you seriously wanted to engage with public health, that you could use your informal influence to correct some of the misinformation that was spread.
Thank you, Councillor Wilmore. Sure. And can I just
It was a polite
bring some?
request.
Can I bring some order? Can I bring some order to the committee, please? When you're addressing this committee, you're addressing the chair, not addressing each other. Please, can you go via the chair, and then we can have that discussion. In terms of your wider plan, you can take that up with Councillor Amos on a private
Chair, I thought it was
occasion.
an opportune
This is
moment to share some
Understood.
good practice.
Thank you, Councillor Wilmore.
Good practice.
We were addressing the public health practitioner, Matthew Fung, here. So the question is to Matthew Fung, if there is
So
any.
my specific question is around the Area 1 deep data dives, where we know that there are negligible rates of things like health checks. Do you know if there are particular demographics within those areas who are not taking up their health checks? Is it more of, like we know that there's an exploding elderly population. Is it more within that group and could be things to do with digital literacy or the way that health checks are promoted? Or is it within different groups who we need to think about targeting the messages differently?
Yeah, thanks. It's a good question. Obviously, it's going to vary based on each of those areas, which are different. There are different reasons for them being highlighted. Interestingly, the areas that we have deep dived into haven't been necessarily elderly, haven't been necessarily diverse. They've typically been very working class white communities that are typically younger. So it's not what you would assume would be the case. So I think what it led us to was actually you can't make any assumptions about these communities without really understanding who the people are. So you would have thought, young people, they'd be right on it, or younger people, right on it with, the tech and responding to messages. Doesn't always hold true, particularly in some of our more working class white communities that are not necessarily older, but kind of younger, 60 and below, really. So it was interesting and eye-opening at the same time.
Thank you. Does that answer your question, Councillor Wilmore? Thank you. The wider point is noted in terms of what's not, but I think that's a debate. I think point well made, but if you didn't name names, then it would have been allowed. No. Can I have Councillor Lawrenson, please?
Thank you, Chair. Thank you, Matt, as always. I have to confess I wasn't aware about the community wellbeing grants until this evening, so shame on me, but now I know about them. So the questions are how best to apply for them, or how best to apply for a community wellbeing grant, who can apply, and is there a financial limit, or are there any limits to what people can apply for? Thank you.
And there'll be, thank you. It's like magic, wasn't it? And then you'll be able to kind of find how you apply to the grants there. What was your second question? It was who can apply? Principally community groups. That's the idea behind this. We don't tend to. I don't think we're not permitted to fund for profits. We have given out some grants to, as I say, VCS, and to we have kind of schools as well who've applied for grants. Threshold generally around about £3,000, no more than. That's kind of the threshold that we work to. So they're very small grants. The idea behind them is to really kickstart grassroots projects to get them off the ground. People have bought all kinds of stuff, torches to go out on walking, men's walking groups, for instance. I was going to actually mention the PCN here as well, who have applied for not such a community grant, but a grant to do something different. So we did give some money to Worcester PCN to do slipper swap. I don't know whether you heard about that. That took place here in the Guildhall. That was a fantastic programme of work. Very simple, literally taking old slippers from people and giving them new slippers. One of the reasons being older people were tripping on their slippers, breaking a hip, and ending up in hospital for 6 months. So giving some slippers was a real kind of benefit, like a cost, an investor save type of initiative. There's a spectrum, is what I'll say, but generally speaking, for community groups, it's around the 3K mark. Quite often, it might be just a couple of £100 that people need. We just need this little bit of equipment to get going. So yeah, I'll give you a flavour. And anyway, look on our website, because that'll give you a whole spectrum of things that people have done with their bits of money.
Yeah, thanks. Just interesting about there was 95 applications the previous year, and 2 years ago, and there was 50 applications the previous year. There was a big difference in between the three numbers. Just wondering, was there a particular push in that middle year for regarding your grants, and why is it kind of stabilised?
It really depends on what's out there and who is doing what. There will come a point as well, because the idea behind the grants is that they're not recurrent. We're not funding recurrent activity. Does that make sense? So we only have so many groups and so many people, so you would expect a natural waning of that particular graph as well. So if there are lots of other people in Worcester City who haven't been funded yet, and there's an opportunity there, then let's have a conversation.
Thank you. Councillor Holmes and then Councillor Lamb.
Thank you, Chair. My question pertains to a few years ago, we were both on health and wellbeing, and at one of those, and it wasn't yourself, it was other members of the NHS again, and they talked about a mobile GP service that was being set up, and I was wondering if that's still operating, whether it's been successful, and I suggested to them they did likewise with a dental surgery, and to take the dental surgery to the people, because many people are struggling for public transport, they're struggling with their day-to-day access, they can't leave vulnerable people or children alone. So it's better that the services go to them, and that might help overall. And my second was, I did speak to you about this, and it was about the offer of catch-up vaccination courses to teens and young adults who hadn't been taken by their parents, to give them the opportunity when they realise the health risks. So an advertising and a catch-up, particularly with the university, many of them may be mixing for the first time and be exposed inadvertently to quite a lot of things they don't realise they're not protected to, because they didn't have them as young children. So that was my questions. Thank you.
Thank you. I think the mobile GP service was Your Health, Your Wellbeing, the vans that were going on. I'm not sure about a mobile GP service per se. We're always thinking about how we can best deliver services, particularly to our more rural populations, which doesn't so much affect Worcester City, but certainly around the wider county. I think it's fair to say the ICB, the NHS, as you probably know, is being reshaped significantly. Is probably the politest way to put it. There's lots of change going on and lots of things that are being kind of reconsidered. The way in which we offer services to particularly, I would argue, homeless people is going to be reshaped outside of the Your Health service that I'm not sure whether you're talking about or not. There's also going to be a new out-of-hours GP provider as well, so that's commissioned by the NHS. So, yes, there are elements of that. I don't think it's a specific mobile GP that will just go out to visit around the county as a bespoke service. There may be some home visits that are done by some GP practices, but I guess that's for them to kind of talk about that in a bit more detail. Catch-up vaccination, it's a great point because we are literally in the middle of a catch-up vaccination campaign at the moment. We're running pop-up clinics across Worcestershire. Again, you can Google this. It's being delivered by Vaccination UK, and we're aiming to boost people or to offer vaccination around MMR, HPV, meningococcal jabs, which is the most pertinent to our university students, because there are some tragic cases about some students dying because of meningococcal infection, which is awful and preventable, and flu as well. So those are literally ongoing. We're using family hubs, we're using community centres. There's one, I think the one on Saturday is in Stourport, but they're going around the county, so that's literally ongoing. And there will be I'm doing an interview with the press in the morning on it as well. So there we go. It's really live.
Yes, thank you. And the last speaker on this item will be Councillor Mutlam.
Thank you, Chair. Yeah, I was really pleased to see in the presentation about the focused early support and intervention in areas of deprivation, not just in Worcester, but in other areas that I know very well in the county, such as the Walshes in Stourport and Birching and Coppice in Kidderminster. And, you know, this talk about parenting classes, for example, one of the things that reminds me, one of the great successes of the last Labour government was Sure Start, which understood that intervention in those first 5 years of life is incredibly important. But very, very sadly, after 2010, it was all rolled back, you know, because these kind of programmes don't have positive outcomes after 6 months, 2 years, it's 20 years. And all the evidence now shows that Sure Start as a programme, all the positive changes are now coming through. So what was really encouraging is obviously last summer, the present Labour government obviously announced its Best Start programme, which is, you know, a kind of successor programme, which again is focusing on from pregnancy to the age of 5. So how do you anticipate that impacting on your work? You know, because that's obviously a programme which is fitting in with a lot of the things you've already discussed. So you do anticipate more support and more financial support from central government? How do you think it's going to change what you do?
I think it's all going in the same direction. Yes, we have had some more financial support around family hubs. We actually preempted all of that, and we made a start on our family hub model before nationally they kind of allocated any funding to us at all. So we kind of had a head start there. Best Start programme, it all fits together, to be honest. It's all part of the same model, and we'll carry on doing more of it because we see it as such an important, critical, really, aspect of what we do. So we have a whole team dedicated to kind of this area of work around Best Start in life and kind of building up our family hub offer. And it's still early days. We're going to evaluate. We're going to see how it goes, and yeah, carry on doing more of it. Kind of pushing into the stuff that really works, and you know, changing up things that we can improve. So I hope next year to be able to report back on perhaps some of what they've been up to.
Yeah, thank you, Matt. Really appreciate that. And a number of obviously significant amount of data to process in terms of that. This will really help us in terms of the Pride and Place in Warndon programme, which is due to start imminently in terms of that and how we approach that. So there will be a call out to organisations to be on the ready in terms of data, what work is already going on, trying to map that in terms of actually what are the interventions then the community chooses in order to do that. And I think it's really important that actually we have an honest approach about it. Actually, where did we go wrong before? Why hasn't this data to this level been done that? Obviously, those are political choices made by the previous administration, previous government in terms of focusing of resources and a particular strategy into more leafier neighbourhoods, let's say, in terms of that, and that's why a lot of these areas have fallen behind in terms of that. So appreciate all your effort and support in terms of that and the information that you've spread. We'll agree to disagree on some of the approaches, but I think we've got a good data set in terms of from a city perspective to nail down in the issues that we need to kind of address. So appreciate your time. Thank you. Thank you, Matt. Agenda item 6 is the MT medium-term financial plan. Rachel?
Thanks, Chair. So the purpose of the report is to provide an update on the medium-term financial plan to councillors in advance of them having the council meeting in February. It provides an opportunity for you to ask questions or comment on any things in that appendix which is pertinent to the remit of this committee here tonight. Just to give you a flavour, the appendices that you've got has been to each policy committee, so everybody's had the same level of information. So it provides context for the decisions and the budget reductions or budget growth that might be there for each item. There are a couple of things that I just wanted to draw to people's attention, specifically about communities committee tonight. So in paragraph 2.3, you can see that there's a proposal in the budget to substitute grant funding, replace our council-based budget with grant funding for our DWAS programme. So this isn't about changing the programme, it's just about switching funding sources, and that should hopefully provide us with a £102,000 saving. The appendix that you've got there, just want to draw your attention to the fact that we've got the Crisis Resilience Fund, which has been introduced from April 2026, and that is an amalgamation of what was the Household Support Fund and discretionary housing payments. So we do have now some certainty over the value of those grants for the next 3 years, albeit there is a complication that part of the grant gets paid to county in these first 2 years, so we're just waiting for our allocation of that from county. And then on housing, there's been quite a change with the number of grants. That in 1.4, there's 4 grants there listed that have sort of been merged into one grant now called the Homelessness and Rough Sleeping and Domestic Abuse Grant. So it's quite a mouthful, but we have had that grant confirmed at £1.1 million for the next 3 years. So again, it provides Tom and his team with some certainty about how to plan for the future in terms of, we know what money we're going to get. As part of some of those changes with the way that the funding has come through, a grant that we previously received for temporary, for temporary accommodation, that has been built into sort of what I'd class as mainstream funding now. So that's part of what was revenue support grant. And in one of the tables where everything sort of gets pulled together, in table 3, you can see that we've actually built in a base budget now of £510,000 rather than have that funded from external funds. In table 3, you will see a summary of how we've built up the expenditure side of the budget, and then I've summarised various funding streams there. And over the life of the medium-term financial plan, which is 5 years, we hope to have a balanced budget. I say hope because it's very easy to make numbers come back to zero on a page. It's all about how they're delivered going forwards. There are a significant amount of estimates and assumptions that go into building a budget, and really the hard work starts now in delivering it rather than just preparing it. And obviously in later years there's more uncertainty about those budget items. I think that's all I was going to say on this, but happy to take any questions, Chair.
Thank you, Rachel. I'll open it up to the floor. Councillor Lawrenson, Amos, Murray and Kinnersley.
Thank you, Chair. Thank you, Rachel. So I've got, well, kind of two sets of questions. The first set is about, on page 2, it's about a mention of risk, a risk rating of 9. And that relates to whether the council was able to deliver its medium-term financial plan, given the various factors it needs to bear in mind, such as local government funding, the general economy, and so on. So, two-parter first of all, if that's okay, Chair. Would it be correct to say 9 is quite high? And secondly, how confident is the council in terms of responding to that risk? And then, if I may, I'm going to come back to some minor questions after that. Is that okay? But quick ones, I promise.
No problem. Okay. Rachel?
Yeah. Okay, so yes, 9 is high, but I've listed there a number of significant risks, and you know, the first one being the capital schemes that we've got started, or you know, we're trying to get into contract. You know, until we've actually got, you know, firm plans and contracts signed and some of those programs delivered, you know, there's always an inherent risk there. In terms of confidence, like I was just sort of saying that in one way, the easy part is actually coming up with the plan, but it's about delivering that plan. So, you know, it's incumbent for all officers to, you know, they've worked with finance teams to agree a budget per se. And now we've just got to hope that demand doesn't mean that we need to spend more than what we've got allocated, or if we have to in one area of the council, that we can find savings in other areas. So I think it's deliverable. You know, that there's a lot of estimates there, but we haven't been reckless, and you know, we try to build in prudence across the board. So, you know, with fair wind and no alarms and, you know, nothing happening, then yeah.
Thank you. And thank you, Rachel. Just quickly, Chair, yeah. So to relate to, there's a mention of premises cleaning on page 13 and postal imprinting costs. And for the year 26-27, there's £0 being spent on cleaning and printing. I just wondered why that was, or why no money has been spent on those two items.
No, I haven't got your page numbering, but if I think you know what you're referring to, it's not about, these aren't what we actually spend now, these are changes to what we will spend. So if it's a positive number, we're putting more money into that budget. If it's a negative number, we are reducing the current budgets. So I can't find the number on the printing one at the moment, but
yeah, my bad. Thank you for clarifying it.
Yeah, so that explains that.
Perfect, thank you. Cheers. Thanks, Chair.
Thank you. Councillor Amos?
Yes, thank you, Chair. Just two questions, actually, if they're within the remit of this committee. 1.26, food waste, is that within our remit?
That would have been environment last night, I'm afraid.
Okay, that's fine. And the other one was 1.28, councillors' pensions, is that within our remit?
I think I'm happy to take, because it is a general one and it affects everybody. So, what's the question? Yeah.
Well, the question is, Chair, obviously this seems to be an initiative from central government because the ministers have undertaken the consultation. And I'm just a bit amazed that it has come to council. I mean, we've got a financial crisis on, but what we're doing, we're putting in an extra 20,000 for members' pensions. I was always told that what we get is not a salary, it's an allowance. So I'm not quite sure how an allowance would come in within the remit of a pension scheme. But the other point is this not completely inappropriate at this time? Because where the council, in effect, is going to have to put up council tax to pay for councillors' pensions, those who take them, at a time of severe financial difficulty. So if a member wants a pension, would the best thing simply not to be to deduct the employer's 20% off the member's allowance? Otherwise, all we're doing is giving some members an extra amount because it's on their pension, which they haven't had before, and it's a growth item of 20,000. If more councillors take the pension, then of course the 20,000 goes up. And at a time when we've got real financial difficulties, do we really think, Chair, this is appropriate? Because I don't see why Worcester residents should be subsidising councillors' pensions. It's not a salary job, it's an allowance.
Through you, Chair. This scheme was in place a number of years ago. It was then pulled. So, you know, say about 15 years ago, councillors were entitled to be eligible for a local government pension. That changed. There's a consultation now. I haven't seen the outcome of that consultation, so I don't know that it's definitely going to happen. But until I can see some outputs from that consultation, I've built in a budget, because ultimately nobody in here can actually determine what goes on with that. You know, that's a national government item, so I'm just reacting to that in terms of making budget provision for it. So that's where I think we are at the moment with that pension.
In those circumstances, Chair, would it not be more sensible to cross that bridge when we come to it? If we don't know what the consultation is, if the council hasn't made a decision, why are we putting 20,000, which is actually into the base budget, is going to grow every year?
Yeah, so the consultation has finished. It's a national consultation, and everything I have read and been told, and I've been in liaising with the Worcestershire Pension Fund and Section 151's there, we still think there's a chance that it will come into Act from the 1st of April 2026. So in terms of trying to set a prudent budget where we've covered everything, I didn't want anybody to go into next financial year thinking we've got a balanced budget, and then the result of this consultation means we need another 20, 50 or whatever amount of money it would be. So in this draft position that we're in at the moment, I've built it in. But if central government announces the consultation and they don't want to go ahead with it, then I will gladly put it out as quickly as I can, so that there's more resources available for all the services.
Thanks. I think it's just from a Rachel's perspective, it's just prudent financial planning ahead. That's rather than any, you know, rather than Rachel taking a decision on our behalf. Councillor Kinnersley.
Thank you, Chair. Yes, so I just wanted to refer to sort of paragraphs 1.3 to 1.5, which I think is very relevant to this committee. So it just looks, in terms of the general picture of how these grants are working, am I right in thinking that there's a sort of a degree of simplification of the grants are being absorbed, reduced down to a smaller number, and that some of them are being incorporated into the revenue support grants? So there's a, am I right in thinking that, does that give more flexibility over how this money could be spent? But on the flip side of that, is there then also a danger that the money that was previously allocated specifically to a housing-related purpose could be sort of siphoned off into some other part of the council's expenditure, or is it going to be sort of ring-fenced clearly for what the original purpose is for? Thank you.
That's a really good question, and part of it is simplification and more flexibility, and then there are some grants where they've been sort of amalgamated into one, but then there's still a lot of set criteria between them. So it's almost like we had 4 separate grants again. So that's certainly the housing one, isn't it? So it's helped on some parts, and then other parts it's more of a heading. So I hope that helps.
Okay, do we have any, Councillor Lam?
Thank you very much. Forgive my indulgence on this one, because obviously, because I chair full council, this is my only opportunity to ask any questions, because I won't be able to ask any questions in council, because I'm going to be chairing it. So forgive me if these aren't directly related to this committee, but obviously Rachel and Lloyd are here, so it's quite useful. So on 1.10, where it talks about policy and resources agreed to introduce 100% premium on long-term empty properties after a period of 12 months rather than 2 years, how much money do we anticipate that raising? That's my first question.
Okay, that went to full council before Christmas, so you shouldn't get a question on that, but that was around £45,000 for the district, which represents 10% of the total, because of the way council tax works in terms of the county and fire and police.
And thank you. And could I ask a sort of very slightly esoteric question, I suppose? Under planning and governance, it's got an item here which said there's going to be a £7,000 saving from scrapping the mayor's inaugural banquet. I actually think that item on the budget is misleading, to be honest with you, because the mayor has always been given a £10,000 budget, and there's been custom and practice that the mayor can or cannot decide to hold an inaugural banquet. There's never been an item in the budget for an inaugural banquet. There's been an item in the budget for a mayor's budget of £10,000. So what you're effectively doing here is you're cutting the mayor's budget by 70%. So I personally think this is misleading, because some mayors have the inaugural banquet, some don't. Louis didn't hold an inaugural banquet, I did, for example. But this is actually effectively a cut in the mayor's budget by 70%. So Tor will have a budget of £3,000, whereas I had a budget this year of £10,000. And nowhere have I seen this debated, if I'm honest. And I've asked this question in several different kind of forums and not really had a response.
All I can say is I can take that back. That was, it was savings ideas that have been put forward from services across the council, and I'll get you an answer.
I think that does need to be answered, because, it means the mayor has... We talk about the council doing things, and that means the mayor, which is the civic leader of the council and of the city, will do less, because they'll have less money.
I am aware that the Deputy Mayor has been consulted on this. So rightly or wrongly, or with a wider consultation, and that's partly why we're here tonight, having all of that detail, so that, that line, I believe, was actually in the P&R report as well in December. So it's been in the public domain for a while, but not perhaps specifically owned in on. So, that's about getting those things cleared up now before council.
Which, as I said, this is my opportunity, because I'm not on P&R. So this is my opportunity, because I picked this up to ask that question.
But as a former mayor, Councillor Matt Lamb, I hear you. Think of Councillor Murray.
Thank you, Chair. I think earlier I said I was going to speak on item 8, and a few of you looked a bit puzzled. You knew I meant item 6. So on item 6, I welcome the inclusion of the funding for the Lippard Hub in the draft budget. £19,000 might sound like a modest figure on a spreadsheet, but to people who rely on this centre, it means everything. Lippard Hub is so much more than a local resource for Wandon villages. It draws residents from across the city. It runs youth clubs that offer safety, mentoring and purpose, especially for boys who may lack positive role models. It supports new mums, carers, the bereaved, people living with dementia, and yes, even belly dancing classes. These things build communities in joyful ways, but we need to look beyond this year. Worcester City Council will cease to exist by 2028. And while we can't tie the hands of the new unitary authority, we can send a message from this chamber that supporting community centres is not an add-on, it's essential to prevention, connection and local well-being. Will this committee join me in doing all that we can to ensure that these centres are protected now and in years to come? Thank you.
Thank you, Councillor Murray. Obviously, as a local ward councillor, you're perfectly entitled to defend the assets in your building, and we will all love our community centres in terms of that. But I do need to kind of say, in terms of standardisation, the amount of money Lippard Grange does get is higher than if you give it per average to any other community centre within this city in terms of that. So it's 95,000, I think, was this community trust get across 6 centres, and Lippard Hub is getting more than that, and you've got a parish council within that, so you're under a parish council in terms of that. So that is a legacy of a previous funding formula under the Tory government and the Tory leadership that was in this council. So, whether that remains the same going forward, I can't promise that, and neither can that. But in terms of if they were standardising other grants within our budgets, that I can't make a promise that that won't be standardised going forward. However, the wider point in terms of protecting services and protecting our community centres, absolutely agree with you in terms of that. So, and I don't think there's anybody here around the table who would say, actually, our community centres are the life centre and lifeblood of our communities and provide so much value. So, absolutely agree in terms of that. Right. Have any other speakers on the MTFP? No? Can you note those then, please? Right. Tom, over to you. Worcester City Community Engagement Strategy, Agenda Item 7.
Thank you, Chair. So this report is seeking approval to undertake public and stakeholder consultation around the development, to help inform the development of a new community engagement strategy for this council. I think as members of this committee will be aware, we've got a long established approach to engaging with our communities and have adopted a asset-based approach to community development over a number of years. What we don't have in place currently is a community engagement strategy to help sort of shape and direct the approach to community engagement for both members of the community as well as officers to be directed by. What we are seeking to achieve through this strategy is for it to be a corporate approach to community engagement and to embed community engagement practices across the council within all of the council services, not just within the community services team. What we've developed is a set of approaches and principles, and the intention is to use that as a basis to go out to consult with stakeholders and communities on. We've set out some proposed vision, aims and objectives for the community engagement strategy, which we will be seeking feedback and response to. The primary objectives of the strategy include how we can build trust and develop relationships with members of the community and community-based organisations, identify opportunities to increase participation, how we can improve integration and community cohesion across the city, as well as promoting civic pride, local ownership, and ensuring that we're compliant with our statutory duties around the Equalities Act. As I'm sure members of the committee will be aware, local government faces some significant challenges currently, as well as in the near future, with significant change taking place. So it's now particularly relevant and important that we're working with communities during that period of change and transition. We've got local government reorganisation on the horizon, where there will be the establishment of neighbourhood area committees and promoting more community participation and meaningful community engagement activity. There's also activities such as the Pride in Place programme in Warnham West in the city. It's been identified as one of the neighbourhoods that's going to benefit from funding, and a key element of engaging with that programme will be developing links and ties with the community and building capacity within the community in that locality. The community engagement strategy also ties in with a number of existing strategies that we have within the city, obviously the city plan, as well as a consultation and engagement strategy, environmental sustainability strategy. So it brings a number of those things together, focused on how we actually engage with individuals and communities in the city. So I've attached a copy of the approaches and principles as Appendix 1 to this report. And the intention is to use that as a basis to engage with stakeholders and communities. It's a fairly detailed document, and I think it will essentially need to be used in different ways, in different contexts and with different people. So we don't intend to circulate that as our means of consultation. But what we intend to do is approach that in a few different ways. So we'll be developing an online questionnaire. What we recognise is that we won't reach many individuals and communities who are currently more underrepresented. So we'll be working with existing assets such as faith-based organisations, voluntary organisations, community groups that have established connections to engage and to gain feedback about, to help inform and shape the strategy. So the intention, so what I'm seeking today is approval to go out to consultation, and then for that consultation to inform the development of the community engagement strategy to be brought back to this committee in the summer this year. Thank you, Chair.
Tom, I'll open it up to the floor. Councillor Sarah, Councillor Gilmore, Councillor Lawrenson.
Thank you, Chair. So I understand that this is not what will be sent out for consultation, this appendix that we've got here, is that right? So exactly what will be sent out for consultation is my first question, I suppose. Secondly, are we examining where our previous attempts at engaging and consulting have worked and where they haven't? I mean, in terms of location. I know we get information, I've seen information about demographics and stuff like that, but not necessarily location. And the final question was, is there a review of the estimated man days that this consultation, and maybe even future ones, might need as against what's available to support it? Thank you.
Yeah, so in terms of what will go out as part of the consultation, I think that will be sort of tailored to the audience. So we haven't yet developed the public questionnaire, which will be sort of widely available, but we'll be pulling out elements from the document. So, for instance, we'll be seeking responses to the aims and the objectives of the strategy. So we're pulling elements from the document that we've circulated, not just sharing it as an entirety. With some of our, I suppose, more developed stakeholders, so the likes of some of our bigger community-based organisations, then it might be the document that we share with them, who may have a greater depth of understanding around some of the principles and approaches. In terms of location, I mean, we've applied things in different ways with probably varying levels of success. So what sprung to mind was an example during the cost of living crisis, and sort of recognising that some localities we did get very limited engagement from, but were perhaps the areas that had the greatest level of need and weren't accessing services. So again, we adopted a slightly different approach by using a range of different means, through door knocking, through physical pop-up events within those localities and at places that we know that members of those communities would be accessing. So very much sort of going to them, and that's very much the principle of community engagement, is going to the community and where they are, where they access, rather than expecting people to come to us. And then finally on the question about resources, we are in the process of, we've recruited some new capacity and resources within the team. and are currently in the process of recruiting additional officers. So resource will be a short-term pressure and challenge. We do have some capacity within the team. We are doing a series of events and engagement specifically at Warndon West, so we're able to gather in and gain intelligence feedback through that process. So there will be limitations around the scale and breadth of consultation that we'll be able to undertake, but the intention is to try and get out as wide as possible, and through some of those established connections and assets that we already have in community.
Thank you.
Okay, Councillor Wilmot.
Thank you, Chair. I was just wondering, under the section in the appendix around building officer skills and capacity, it said that officers will receive training in facilitation, accessible communication and community outreach. Is there any option to also increase the training for some of the approaches that might be required for this? I'm thinking sort of qualitative research skills about how different approaches can lend to different questions and the different ways that that those questions might even be thought of, let alone asked, let alone how they are interpreted and analysed and presented back. I'm just wondering whether our colleagues at the university might be able to offer some of that support. And whilst the engagement is brilliant, I also wonder if we're missing a trick here in terms of co-producing some of these questionnaires and engagement activities like focus groups or what have you, rather than it being driven by us, that it's a genuine co-produced approach where the members of the communities reach and get their opinions on, contribute to the design of those events and the questions that are asked.
Thank you, Chair. Yeah, so a very timely point about the research skills and that side of things. I was having a conversation with our new community development and partnership manager about that this evening. So yeah, and part of that will, I suppose, depend on recognising the skills and skills within the team that we have, but certainly it's an area that we would be welcome to explore, and utilising those links with the university is a good suggestion, so thank you for that. And on co-production, I mean, we do value co-production, and what we didn't want to do through this approach was to develop a whole new strategy and then just share that and say, what do you think? And I'm mindful that we've gone halfway there with developing some principles and approaches and suggested aims, objectives, etc. But really that's to just kickstart the conversation rather than for that to be the final document. So we very much want to do that co-production piece. Again, there's probably some limitation around sort of capacity and how far we can go with that within a sort of set time frame. But very much we intend the community engagement strategy to look and feel and to be recognised by the community, that it's their document as much as it is the City Council's.
Does that answer your question, Councillor Wilmot? Right, Councillor Lawrenson.
Thank you, Chair. Thank you, Tom. So my question is, if you're allowed to tell me, what is the salary for the Community Development and Partnerships Manager? And second question related to that, will they be mainly responsible for securing grant money to pay for officers and or projects? Thank you.
Yeah, I mean, I couldn't comment on the salary, I wouldn't know off the top of my head. I mean, we are committed to identifying grant opportunities. So wherever possible, we can bring in additional funding to the city. It's something that we proactively do, whether that's through engaging with the likes of public health and seeking funding through them, or outside of that. So we always take that approach, and if we have the opportunity to bring in funding and we can use that to extend our community engagement capacity, then we will do.
Thank you, Councillor Kinnersley.
Thank you, Chair. So I've got I mean, bearing in mind what you're saying just now about this document as it is isn't necessarily going to go out in the form that it is to residents, but I still wanted to share a couple of thoughts I had about some of the wording that is presented. In particular, the first one is one of the three aims. The first one, if I can find myself to it, here we go. The strategy will seek to achieve three aims. Number one being represent the interests of Worcester on key strategic issues. And I'm not entirely sure that's really what this strategy is about. And I wonder if the wording is more like facilitating the representation of the residents of Worcester, which is a bit wordy, but you see what I mean? It's more about, making those voices heard rather than we're going to be sharing our views. So that's my first one. And then my second point was sort of buried much further down, page 41, honest feedback loops. That was about the only place where I could see reference to, and what happens with this information that is gathered? How does it influence whatever it is that you're consulting on? How do people know the impact? And I think it's really important that maybe is strengthened a little bit, because if people don't feel that what they say is listened to and actually changes things, they're not going to bother sort of talking. So it's just a couple of suggestions there on that document. Okay, thank you.
Thank you, Chair. Yeah, duly noted. So I'll take those away. Thank you.
Thank you. I don't have any other speakers on the item. Are we happy then to note 1.1 to 1.3? All those in favour? Thank you. Any against? Any abstentions? No, that's carried. Thank you. And then we have the agenda item 8, preparing for the Renters' Rights Act 2025.
Thank you, Chair. So this is an information report to update members around the Renters' Rights Act, which received royal assent on the 27th of October last year. So it's particularly relevant to this committee as it introduces some significant changes to the private rented sector market in England. And the primary focus is around enhancing protection for tenants, as well as establishing a range of new responsibilities and obligations for landlords. It also places new duties on local authorities, and that will have a direct impact on our housing service, both in terms of the provision of advice and information, as well as our sort of regulatory activity. So that spans our private sector housing functions and homelessness and housing advice areas. So the intention of this report is to provide an overview of the Act, what it means in practice, and then some of the actions that we're undertaking in preparedness for the Act being implemented. It also responds to a motion that was approved at the council meeting in November surrounding the Renters' Rights Act. So it's bringing that back to this committee on the back of that motion. So there's a risk of this getting very, very technical very quickly. I've tried to summarise it within the report, and I'll try to further summarise it as I run through this. But essentially, the Act will be implemented across 3 phases. The first phase takes effect from the 1st of May this year, which is probably the sort of biggest headlines that may have been announced publicly. So that involves the abolishment of Section 21 notices, so they're the no-fault evictions. It introduces assured periodic tenancies in the private rented sector. So essentially, tenants will be issued for as long as people want to stay in that property. So it won't be a standard periodic tenancy. And tenants will be able to end their tenancy by giving 2 months' notice. It reforms the possession grounds in the private rented sector. So that gives rights to landlords around the grounds that they're able to seek possession, as well as protection for tenants. So again, surrounding that sort of abolishment of no-fault evictions. That provides limitations around rent increases, so they can now only be undertaken. They will now only be able to be undertaken once a year. It bans rental bidding and the requirement to pay rent in advance. That can't drive up prices of rent in the private rented sector artificially. There's measures to make it illegal to discriminate against renters. So that's where, for instance, they have children, so some landlords won't rent to children, or where they receive benefits. It requires landlords to consider requests for tenants to have a pet in a property, so there can't be a blanket no pet rule within properties, and each of those must be considered on a case-by-case basis. And it also strengthens the local authorities' enforcement powers. So there's additional powers that we will have available to us. Civil penalties and the levels that we can apply will be expanded. And there's also a new duty for us to report additional enforcement activity that we don't currently do. Should be worth saying that this does initially solely apply to the private rented sector, with the intention that it's rolled out to the social rented sector during the second phase of the Act being implemented. Phase 2 is due to take effect from later this year. No definitive timescales or dates have been announced yet. This involves the rollout of a database for landlords. And so all landlords will have to register on the private rented sector database, which will be a national database. Where we'll have to provide a range of details, so the landlord's contact details, information about the property, size, number of bedrooms, as well as all the compliance information, gas safety certificate, electrical certificate, etc. So tenants can see that the property's safe, know who their landlord is, know who to contact, etc., which can sometimes be ambiguous. The second stage of phase 2 involves the rollout, the further rollout of the database. So initially it will be on a regional basis, then it will be extended out, and there'll also be the introduction of a new ombudsman for the private rented sector. So that gives a redress service that doesn't currently exist for tenants in the private rented sector. Phase 3 then involves the introduction of a decent home standard in the private rented sector. We're awaiting dates surrounding that, but it's anticipated to be approximately 10 years' time from now of the date that will take effect. However, there's an expectation that landlords are beginning to work towards that now. So recognising that there's work to be done to improve property standards. So that's something that we'll be working on ahead of that being mandated. In terms of impact on the service, we anticipate the primary impacts to relate to increased demand, essentially. So that's likely to be around more inquiries from tenants seeking advice about their rights, identifying enforcement of offences, particularly as there's a range of new offences that have been introduced as part of the Act, as well as an anticipated increase in homelessness presentations, particularly in the lead up to the Act's being implemented. So between now and May, that's a sort of an area of risk, I suppose. And then following the implementation of phase 1, there's the risk of potential reduction in the private rented sector. So what we don't know is how this will impact the private rented sector in its whole, and whether landlords will begin to exit the market, essentially. But the private rented sector is a really important means of the provision of housing. As we know, there's pressures in the social rented sector. So there's a range of things that the local authority hasn't dealt with previously. So things like anti-discrimination practices, rent bidding, unreasonable refusal of pets as not a sort of a usual enforcement function of the authority. So they're new processes that we need to embed within the service. We've been trying to map the level of demand and the volume of work that we believe this to do, and we've been speaking with government around this, as well as neighbouring authorities to try and understand and appreciate the sort of level of need. But it is proving to be somewhat difficult. So we can do some forecasting, we can look at data, we can look at the number of properties that we know it could affect, but until it's sort of implemented, there'll be there is some. So we can anticipate there'll be a demand, but the extent of it is somewhat unclear at this stage. We have. Okay, so in terms of next steps, so the government have announced a roadmap, so I've attached a copy of that, a summary of that at Appendix 1, so that provides the key sort of dates and timelines that that are associated with the implementation of the Act. We've developed our own action plan to set out the various actions and things that we need to do as an authority in preparedness for the implementation of the Act, which we're working through as a project team. As I've mentioned, we're doing work to try and understand and anticipate the demand of the service. The things that we're looking at are whether there's been any shift of behaviour. So are we beginning to see more landlords serving Section 21 notices now? We know that has been the case elsewhere. We're not necessarily picking up any sharp increase here yet, but mindful that that could increase as we approach May. We've been looking at resources within the team, both within the private sector housing team and the homelessness team. The area that we are particularly lacking the sort of function is around preventative tenancy relations role. So whilst we have our advice and we have enforcement, we don't have the function where people can come for advice and we can then sort of liaise with the landlord, liaise with the tenant, as well as look at gathering evidence where there's a potential offence that's happened. So it's, I suppose, the link between somebody approaching and seeking advice with our homelessness team and then our enforcement function in the private sector housing team. As I say, there's quite a lot of technical stuff that comes along with this legislation. So training and development and upskilling staff is a priority, and there's a range of courses that are being provided nationally, as well as we're looking at what we can deliver ourselves, and we're hosting the West Midlands course around the enforcement in Worcester. So we'll be receiving that training. We've developed a communications plan, and we are planning a landlord forum as well as a tenant advice forum in the spring this year. So again, just to make sure that landlords are clear about their responsibilities, but also making sure that tenants are aware of their rights ahead of the Act being implemented. We have received an allocation of new burdens funding for this current financial year. We have been advised that we should expect further new burdens funding, both for the additional demand placed on enforcement, but also on homelessness. But we've yet to receive notification of what that figure looks like, and the anticipated spend would be around additional resources where the demand is placed. We have to update things to our IT systems for the reporting requirements, and then there's staffing, training, etc. that needs to be factored in. So that's where we're currently at, and I'm happy to take any questions.
Thank you, Tom. Councillor De Sarah, Murray, Lawrence and Holmes.
Thank you, Chair. So as this all starts to roll out, is your expectation that members should direct queries to your team, or are you also going to be working with things like the Citizens Advice Bureau, and will you, what would be your preferred route for us to go? Them, you, or which?
Yes, that's something we're working on at the moment. So it's likely to be directly to us. We're engaging with a range of stakeholders. So the CAB are a clear and obvious one that people might present to in the first instance. So we need to establish referral pathways to make that as smooth as possible. So to be confirmed, but it's something we've got in sight. We'll confirm that in due course.
Thank you, Councillor Murray.
Thank you, Chair. I certainly welcome this bill in terms of ending discrimination against renters. What's the plan to prevent a reduced supply pushing up rents or increasing homelessness locally? And what practical steps can the council take to stabilise that supply and protect tenants?
Thank you. Yeah, I mean, very challenging. So we can't control rent levels. There are things being introduced within the Act that prevents sort of rent bidding. So it can't be advertised and then two different parties saying, well, I'll pay extra, and a letting agent sort of being complicit in that. I mean, very difficult to evidence and prove and to intervene. But we have limited control around setting rent levels, which are often way above and beyond local housing allowance rates within the city, and where there's significant demand, limited supply, obviously that does increase rent levels. Sorry, I forgot was there a second part to that question? Through Chair, I mean, whilst we very much are committed to protecting tenants' rights, you know, there is a role to play around supporting landlords as well. You know, the private rented sector is a really important housing option for many people in the city, and therefore, you know, working with landlords. So particularly, so there's a role around improving standards, but there's also a role around supporting landlords, and this will be a period of change and transition for them. It does bring additional responsibilities, additional burdens. They have to fund the landlord database, they have to fund the ombudsman, they have to pay towards that. So again, there's more pressures and expectations on landlords. So recognising that, I guess, is important. As well as sort of driving up the standards to improve outcomes for tenants as well.
Thank you. I've got Councillor Lawrence.
Thank you, Chair. Thanks, Tom, for the report. As you said in your overview, the private sector housing team and homelessness team are going to have sort of new responsibilities under the Renters' Rights Act. For example, provision of tenants' rights, liaising between tenants and landlords, and an investigatory role, which to me as a layman, albeit working in the housing sector, but as a layman, that seems a lot of work for current officers to take on in addition to what they already do. And we've received funding of 35,000, and we're awaiting notification of funding for 26-27. My concern is that £35,000, if it was to be around that figure for the coming year, whilst it might pay for training and so on, it wouldn't create hours in the week for officers to do the responsibilities that they're expected to do under the new legislation. So, again, it's a similar question that I asked to Rachel. It's one that I probably ask quite a lot. How confident are we as a council that we can actually perform these new functions so that tenants are advised of their rights under the new legislation, And how confident are we that our existing housing officers aren't going to be overworked?
Yeah, good question. One of the things we're doing is reviewing vacant posts, for instance, so making sure that any replacement posts are focused in the right place. So making the best use of what resources we've already got. Rachel mentioned about the consolidated homelessness grant funding that we've received, and we're just going through the sort of budget setting process and allocation of that grant, and the intention would be to utilise some of that towards this. It will be about homelessness prevention ultimately. If we recognise that we need to be doing things now, so mobilising and recruiting staff now ahead of the 1st of May. If we get some new burdens funding, I think there's a decision, do we use that to offset that funding to release that for use for something else, or do we need to build more resources in? So a combination of the two things, I guess, but recognising that there's likely to be some demand on the service, yeah.
So just to clarify, so to say combination of two things, that's training plus recruitment of new staff. Is that what we're talking about here? We are talking about hiring new staff, possibly.
Yeah, yeah.
Thank you. Councillor Holmes?
Thank you, Chair. Jill touched on something I was actually going to ask, but I'm very pleased to see we're finally getting somewhere with addressing the quality of housing, availability of housing, the health implications that we've heard of earlier, and it will only help renters and I think to some extent landlords to have predictable costs that are set for a period of time. So I'm quite pleased with that. I'm also very pleased to see at long last something about more rights towards people having pets. People have pets, and there's been a lot of pet abandonment because people moving from one rented accommodation to another to fit their budget, and they're no longer able to take their pet with them. So I'm quite pleased that will be coming in. I am concerned about a rash of evictions coming up to the 1st of May, and I'm pleased that the City's taking some steps towards addressing that, even though we don't know quite yet how we're going to tackle that. So I look forward to the 2nd of May and us being on a more firm footing towards implementing the rest of these, which are desperately needed. We really must improve our stock of our housing.
Thank you. Do you want to come back on that? Yeah.
Sorry, was there a question, or is it more a point?
Yeah. Thank you, Councillor Holmes. Any other points around the table regarding this? No. It's been it's a long time coming. I want to congratulate the committee as well. Obviously, the work that we've done over the last few years in terms of trying to improve the housing condition of our stock within the city and the HMO-wide enforcement and the city-wide. It's been a considerable amount of steps that we've done as a committee in terms of trying to improve housing conditions and preventing homelessness within the city. So, and obviously from a national government perspective, it's been a key Labour manifesto pledge in terms of improving that and giving more protection to renters, no-fault evictions, and protecting our most vulnerable. Hopefully those are the measures that this is intended to do, give stability to our renters and bring some sort of stability to the housing market. Obviously, we're not going to solve all the problems, and what you highlighted, Councillor Murray, actually it is an issue of supply and demand, isn't it? We simply just don't have enough houses to build. Sorry, we're not building enough houses quickly enough to supply demand, hence the level of consistent level of people waiting on our housing waiting register. The planning system has a part to play in that, as well as availability of land within our city boundaries, so that we are really constrained. And James will obviously highlight some of those issues in the following group. But this is a huge step, I think, in terms of reassurance and protection. And actually, it's a way for landlords to prepare and to bring some you know, to learn from and to improve housing conditions, because that's ultimately what we're after. So I'll take that. If committee's happy to note the report, thank you. All in favour? Fantastic. Take a 10-minute comfort break, if that's okay, before we come back. Is that all right? Thank you. We okay, Julian? Yeah. Good to go. Okay, agenda item 9, Q3 performance report.
Thank you, Chair. I'll take this one, and conscious of time, so I'll dash through it. Q3 performance report, just in terms of the key projects, all green when completed. Just to reassure members, the leisure contract extension is showing amber, nothing to worry about there. In practice, the contract the extension's in operation. It's just that the formal contract paperwork is following behind, so we've exchanged letters, agreed. We've seen the investment in our 2 centres, so it's just paperwork to follow. Just in terms of the indicators, there's 2 red indicators: community events supported, ABCD conversations, and that links to our reduction in community engagement resource. But we've discussed this evening the plan in place to resolve that. The Find It Do It Worcester red indicator, that's still linked to an IT glitch, which we are trying to resolve so we can get the data back and present it to you. There are 2 technical reasons given for the private sector housing intervention indicator and number of households in temporary accommodation. So if members have questions on that, Tom will be happy to field them. The red indicator for the number of new affordable units, that's an annual indicator, so we'll comment on that in 2 committees' times once we've got through the end of this financial year, and we have a report next on that subject as well. The active participation at leisure centres, that's usually one that glows green. It is amber because we've obviously linked to the contract extension. We've invested in gym equipment at both our key sites, so they were closed for a period of time, which reduced participation. Then the last red indicator, tennis in parks, the narrative suggests that is linked to weather. That can be a little bit up and down, and I've already spoken to Alan New to have a conversation with Freedom to understand that a bit better. So I'll stop there, Chair. Happy to take questions.
Thank you. I'll open it up to the floor. Any questions on this item? Councillor Lawrenson.
Yeah, thank you, Chair. Thank you, Lloyd. Regarding page 11 of the Appendix 1 about private sector housing intervention that Lloyd's just mentioned, and it kind of relates to the previous item as well about the Renters' Rights Act. So there have been fewer sort of interventions than the target. My question is, will the Renters' Rights Act make it easier to carry out enforcement actions such as the prosecution of landlords? I shared with Tom by email a couple of months ago that 2/3 of English councils have not prosecuted a single landlord in the past 3 years, and indeed within this council only 1 landlord was prosecuted between 2022-2024. So will the new legislation enable this council to be more proactive with landlords and other means of enforcement so that housing standards are improved? Thank you.
Yeah, thank you. And you mentioned, sorry, you've asked that question a number of times, I think, Neil, in various guises in this committee. I mean, part of the answer is actually once a intervention is needed and our team intervenes, you understand they give the opportunity of a landlord to fix the problem. So it may be that we've made a lot of interventions and landlords have responded and improved properties, and only, hence only very few left in order to get to prosecution. But I'll get Tom to answer the rest of the question.
Yeah, so the new legislation, the Renters' Rights Act, brings in new offences. So there'll be the opportunity to prosecute for those, but they primarily don't relate to property standards. So not directly necessarily, but it will be addressing sort of poor landlord behaviour, which may lead to other issues being emerging. I suppose what I anticipate to be the case is that through the Renters' Rights Act, that tenants will have more confidence to come forward. So whilst we try and provide as much support and reduce the sort of fear of raising concerns, with the removal of the risk of a no-fault eviction, we would like to think that tenants will feel more confident to report issues. So hopefully we will see more reports coming through, which is what drives this indicator really. So this isn't as a result of not doing activity, it's a result of the amount of reports and contact that we receive. So and we want to encourage that to increase. So hopefully, yeah.
Thank you. Councillor Kinsey.
Thank you, Chair. I wanted to ask about something in that same section, if I may. So I wanted to pick up on the empty homes work that the council is doing. So there's two statistics provided there: 4.6% of where you have responses from owner-occupiers about empty homes, and then also that 20.8% of properties had received a letter that had come off the thing, had received a letter. I'm trying to kind of get a picture from that. I'm struggling a little bit in terms of sort of how much activity the council is able to do in that area and just, you know, kind of how successful it is. So, for example, it sort of suggests that just a letter is sent and that's that, and I suspect that's not the case. So I wonder whether you could just sort of say a little bit more about the work of the council and how successful you think you can be there. Thank you.
Thank you, through you, Chair. Yeah, so, I mean, we've discussed this a few times, I guess, at this committee, and it's always a sort of balance between the resource that is required to be put into bringing empty homes back into use versus the sort of success rate to that. So we do a range of things, both reactive and proactive. So we receive details of any empty homes, empty properties through council tax records, and we write to all of those. Periodically, we respond to reports of empty properties and undertake inspections. We have a problem property group in the authority, which is attended by private sector housing, legal, planning enforcement, to look at ways that we can bring properties back into use. The sort of the stronger powers that we have as an authority to intervene are very resource intensive. So whilst we have done that, it has to be sort of considered on a case-by-case basis. The introduction of the additional council tax premium that was mentioned earlier, again, is a sort of another means of trying to push people where they might just be sitting on an empty property, to push them in, because there'll be a financial implication for that remaining empty. So a range of means. What we do find, so the 20.8% of properties that were removed from the empty homes, we don't know whether that's as a result of our intervention or whether that's just as a result of, you know, they've completed the refurbishment works or, you know, probate's gone through. We never really find that piece of information out, what exactly has happened. But what we do tend to see that there's not that many that are really long-term empty. So it's often as a result of somebody going into care or probate going through or significant refurbishment works at a property. It tends to not be properties that are just sitting, you know, somebody who has an empty property just sitting there doing nothing. There tends to be a sort of valid reason behind it.
Fantastic. Any other questions on that? No? Are we happy to note that report then, please? Noted. Thank you. Agenda item number 10 then, please. We have the Housing Enabling Strategy, James? Yeah, we'll have the public section first, and then we'll go into private session.
Thank you, Chair. This is the last, actually, of the update reports for our 2003-2026 Housing Enabling Strategy and Delivery Plan, which was adopted back in spring 2023. And we have 6 monthly updates. And you'll remember from the previous updates how we've covered background, context, and we've looked at the various strategic goals which are set out in Table 1. Due to the time, and I think because we've gone through a lot of this before, I'll just remind you of the background, context. I'll update you on what we've been doing for the last 6 months. It's the last plan, But in terms of the goals, we'll focus a little bit on goal 1. And in terms of the rest of the goals, as you can read, as you can see by the appendix, we've pretty much completed those actions within the goals. Goal 1 is the actual targets, really, so we can update on that. So as you know, the strategy was developed because the council quite rightly recognised affordable housing is a big issue, and there's a lot of people struggling to access the housing market, and we're not really, as most authorities, we're not developing enough housing to meet our housing need. The strategy was put together within the context of the time in pre-2023, and it was really focused around the council being the enabler and working with partners to deliver. What has happened since, which we have covered, is that a lot of our registered provided partners have not been keen to work on smaller sites. Their interest is really larger sites. There's also been more financial pressure on registered providers because of the interest rates. I was looking actually on the internet when the interest rate increased quickly to 5.25% in August 2023, so 6 months into the strategy, which threw a bit of sort of spanner in the works in terms of development. What we have done, though, is probably not what we intended to. We have moved ourselves into delivery, mostly, predominantly acquisition, and we've secured 9, we'll have secured 9 properties under local authority housing fund schemes. Now that seemed a lot of properties, but actually the infrastructure around buying those properties, refurbish them, putting in the management, registering with various bodies, regulators, etc., that is a whole infrastructure, some of which we weren't aware of before we got involved in it. So that infrastructure has been put in place that if we get an opportunity to acquire more properties, then we know we have the infrastructure there and we know what we're doing. So that's beneficial. We've also been looking at a couple of sites which we will talk about in the confidential section, and we're also looking at perhaps look at some temporary homeless pods about where they could be best sited, which will involve a review of all the land that the council has and a sort of psychosexual test in terms of planning before we can go for a pre-application on that, but that will be done before the end of this plan. If we move on to the actual figures, I mean, we haven't delivered as many affordable housing units in the city as we'd planned. We're expecting around about the 264 level to the target of 500. And when I look back, because let's look about where we got that 500 figure from. If you look at housing delivery trajectories in 2002 and 2001, there are a lot of sites in there that just haven't happened. And we know how long some of the sites, the swimming pool, Sampson Walk, we would have expected that to have completed within 3 years. And even some of the further phases on Sheriff's Gate, and there's stuff in there that doesn't even come up now. So, obviously there is a lot of macroeconomic factors that played into it. The development sector has taken a bit of a dive. I mean, on the extension sites, it's even worse, to be honest with you. And I'm trying to get around why, and these are nominations that we have for the urban extension sites. So outside of our borough or district, but we will have the nomination rights. And there's some fairly large infrastructure sides to it, particularly sort of trunk roads, etc., that have been delayed, that have stopped sites coming forward. There is a bit of a logjam of sites ready to come forward, but it's just the nature of these big strategic sites. The expectation is always higher than the delivery. One thing I would also mention as well is that I think we don't have a lot of sites to work with, but also we don't have any money to work with. And there is a cost to, we can make, when we acquire properties with the Local Authority Housing Fund grant we received, which is quite generous from us, and it is also a fixed amount, so we know how much grant we're getting. So we've been able to acquire properties, and these properties will break even straight away. So we are borrowing money, but we're not creating a deficit. We didn't get any allocation for local authority housing and fall, which was very disappointing, and it was down to the criteria they use, which, whereas we had a direct allocation. So we have applied for more funding, but it does depend on whether there's any left for us. So that's quite disappointing, because that, to us, is the best form of grant, because we get a set amount, so we know what we can do with it, which is not like when you get a Homes England grant, for example. They don't tell you how much grant you're going to get, you bid for it. So that's a little disappointing. So I suppose, looking forward, I think we've learned quite a lot over the, I mean, I wasn't here for the first year, but for the 2 years I've been here, we've learned a lot that we can do a lot, we can do stuff ourselves. We can't rely on partners, and to a certain extent the focus, not just governments in general, is on the big stuff. It's on Wychavon town, you know, the big urban extensions. That's where the big RPs are looking at. The RPs have become bigger, house builders have become bigger. Vistry are, was it Bovis, Lindens, I think, and someone else. Taylor Wimpey is Taylor Woodrow and Wimpey. They've become bigger, and the RP is becoming bigger, and the focus is on the big sites. It's been slightly disappointing, because we also hoped as well that we would get some revenue funding through Prisoners Building Homes, which we talked about on one of the sites before, where we've done some feasibility on sites. They would get some revenue funding to take sites forward to certainly the planning stage. But it may happen, but it's not been announced yet. So that's a little disappointing, but you know, we are where we are. We've achieved what we've achieved. I think we've got an infrastructure in place, and we're not starting from row zero. We're starting down the line. So we need, in light of, as you know, we're coming to the end of 2026. One of the, in the recommendations, we talk about notes that a detailed review of goals and objectives within the housing strategy be undertaken, and options for a new strategic document, renewed strategic document presented to this committee. And we need to think the context that new strategy will be within, including also with LGR as well, because you know that's as a bigger authority, one of the benefits is that we're going to be more on the radar when it comes to funding. We'll have more clout over RPs because we're bigger, rather than just, you know. So I have to take questions on that, whether they're specific or general.
Yeah, thank you, James. I'll open it up to the floor. I'll have Councillor Holmes and then Councillor Kinnersley.
Yeah, thank you, Chair. And you said you're disappointed, and I suspect the officers are disappointed. Certainly us members are disappointed, but mostly the people who are disappointed are those that needed those homes. If they move away from the city because they cannot get homes, then we as a city lose revenue. So it's, you know, it really does need addressing, and it really needs addressing. You know, were the targets too ambitious, or you know, it's just bitterly disappointing to look at that table and know. I mean, the Sanderson Walk was going through planning as I became a councillor in 2021. It's only just started to break ground. What is going on? Why can't we deliver these housing? I know you're not personally responsible, but it just seems we're failing ourselves, and we're failing our residents, or would-be residents, because they've got to go somewhere else. My nephew can't live here. He's got to go to Droitwich.
James?
Thank you, Chair. Yeah, I mean, possibly they were too ambitious, but it was a different environment at the time, and I think these strategies take some time. So we're probably, by the time the research was done, and the council at the time thought, well, let's have a strategy. It was 2001 when it was the start of the 2021-22 to 26 funding round. I remember that time because I was working somewhere else. I remember how aggressive registered providers were then on both Section 106 and land-led sites, and that stopped. And now developers are complaining they can't get RPs to take Section 106 sites. So it was a time when there was a lot of RPs who were quite aggressive in the market, and it changed quite quickly. I still think it was probably a little ambitious for us because if something does go wrong with the site, you're relying on third parties. We don't have land assets as a council, so we haven't gone in saying, well, we've got this site of 100 units here, we've got this brownfield site, or we've knocked down the council house, and we've got this site here. I suppose the swimming pool site was one of those. But again, it's still only 38, 40 units, isn't it? It's not a life-changing, I mean, it's disappointing how long it's taken, as you say, but it's not a life-changing number. I think that it's a mistake not to focus on small sites, and we'd really hope that the government would be funding small sites. I think about small sites in some respects are a lot less, they're far more expensive, but they're not going to be, particularly if we look at the urban extension sites, and I've been trying to get my head around what's not happened, but we're talking about outline permissions of 2015 on these sites. That's 11 years ago. It takes 4 years to get a consent, and these are sites that have been identified in the local plan. They're not sites where it's, and I think that's a bigger issue for all governments, is the fact that housing delivery in general never meets ambitions, and that's been a problem for long. And you'd sit down with a developer, which might be an interesting thing to do, and they will tell you all the problems they've got and why things get held up, etc., etc., etc. And yeah, that's all I can really say. I just share your disappointment, really. Thank you.
Thank you, James. Councillor Kennedy.
Thank you, Chair. It does sound like it's not through lack of effort and trying, so really be commended for that. I'm just wondering, looking to the future, obviously these challenges are still there, not going to go away, and given the close connection between this work and planning, and the fact that we have a South Worcestershire planning document, is one of the proposals, that one of the possibilities for going forward, that there would be, rather than a Worcester City housing enabling strategy, it would be more of a South Worcestershire one, which is sort of, in parallel with the planning document. Is that something that would be considered looking to the future?
Thank you, Chair. I mean, probably not for me to say. I think it's as you say, it will be interesting going through local government reorganisation, where we will effectively be one planning authority anyway, and one housing authority, and therefore, and we do have cross-boundary arrangements. We are fortunate that we do have these cross-boundary agreements, that we do get allocation rights to the extension sites that meet our housing need. So yes, I mean, certainly that's an area we will be looking at in terms of, and that's a discussion with our partners. Obviously, we don't quite know where we are with local government organisation. We don't know, quite where that boundary would lie, but it does make more sense. And also to the city, to some of the, take Shrub Hill, for example, some of the, that is going to require a fair bit of investment. And I think for a more coordinated approach, potentially it will benefit a wider area, but then, it's about sharing resources, isn't it? So, thank you.
Thanks, James. Councillor Sarah.
Thank you, Chair. Yes, obviously I share everyone's disappointment because the need is definitely there, and we all know that. I actually had a question about something that you've written, that is written at 6.6, just because I don't understand it, and I wonder if you could just help me out. So it's the first sentence is pretty straightforward, and then at the second one, which I think relates to the first, or it might do, the council also worked to secure the occupation of the affordable housing scheme, which had been long unoccupied. I just don't understand it. What does it mean to say?
Yes, I mean, is that in the appendix?
Yeah.
Yeah, that is just, it's the site, the Mr. Brooks site, where the affordable units have been empty for a long time.
Sorry, it's in your main thing, not the appendix.
Yeah, so that's the site in Batten Hall, as James said. That was a site that was built out several years ago and had never been occupied.
But now it is.
But we worked hard. I think it was with Bromford, Bromford Housing Association.
Okay, thank you.
And,
It wasn't particularly...
yeah.
Yeah, okay. Thank you.
Do we have any other questions on the agenda item? No? Okay, we're happy to note the report then.
Yes.
Okay, all noted?
Noted.
Good. Right. Okay, we're okay to go into private session. Julian?